A popular heart pump used on cardiovascular patients has now been linked to dozens of deaths and possibly hundreds of injuries, but the FDA refuses to pull the device from the market. No surprise to me. I mean, you know, how many times have we said, yeah, you got an organization that doesn't work. The FDA is dysfunctional. Now, lay the case out. Lay this out, and let's talk about this a little bit.
Yeah, this is involving the Impella heart pump, which is a small little device that they implant into the heart of heart patients undergoing surgery. It's a temporary implant. It does not stay in permanently. And what the FDA has found over and over and over again is that this thing is tearing the walls of the heart. And when that happens, I think it's 80 to 90% fatality
Okay,
rate.
you will die.
Yeah.
There's no question, you will die. And is there an alternative? Yes, there's something called a balloon pump. They don't need this thing that they put in the heart. It ends up, as you can imagine, it tears into the artery. Yeah. Once it tears in the artery, you cannot stop the bleeding there on the operating table.
They have minutes to act before it's death.
Okay, you're going to think I'm making this up right now, but you read the story.
Yes.
Viewers are going to think I'm making this up, but it's right here in the story. The FDA said, oh, we have the solution. Let's put somewhere in the warnings that this might happen. This is a warning to the doctor. It's not a warning to the patient. The warnings are this big, okay? So the patient's supposed to say, well, let me see all the warnings. No patient does that, especially when they're under anesthesia and they decide we're going to use this thing. This is the mentality of the FDA. They are so owned and operated by the pharmaceutical industry that it's beyond belief. And so medical device industry, same thing. And they're all looking for another job, Farron. They all want to say, oh yeah, well, let's give these people a pass. Let's let them keep using this thing that's killed, 46 people?
Yeah.
46 people have died. Other people have barely gotten away with their lives. And they say, well, we're going to keep it out there because these, what we call key opinion leaders from Harvard or Yale and Princeton are out there on the speech circuit saying, well, this isn't so bad. And all you have to do is ask yourself this. There's already something on the market that prevents this. It's called the balloon pump. It does exactly what this thing's supposed to do, okay? But the FDA says, no, there's no risk here because we're going to warn, somewhere in the warnings is this issue. The patient has no way of knowing that. Right. Has no way of saying, doc, wait a damn minute. Don't put this in my heart. Right?
Yeah, and another thing about it too is the FDA does what they usually do. They say, okay, we know it's killing people. We're going to slap our warning on there. And when the public comes asking about it, we're going to say, we need more studies.
Yes.
We need more time. And in that time, people will die.
Yeah.
That's what's happening. And you have cardiovascular surgeons, before the warning was put on, that have now spoken to the press that said,
we told them it was
I won't use it because of how dangerous this is.
And we told them it was going to be a problem.
Yeah.
And at the same time, you have these medical whores or science whores that are coming from Harvard and Yale and Princeton. They pay them $1 million and they say, doc, would you go out and talk about how brilliant this is and how important this is? And of course they sign up. Yeah, I'll be glad to do it for $1 million because I'm only making $250,000. But I'll say any damn thing for $1 million.
Yep.
That's what's happening in that case.
Absolutely.
And unfortunately, the FDA is not going to fix it because they're dysfunctional. I mean, the FDA doesn't work. And we believe it works, but it doesn't. Right. Just like the EPA and SEC, it doesn't work.
That it had helped dirty money flow through its branches around the world, including at least 800...
Plaintiffs allege that the defendants provided money and medical goods to terrorist groups Hezbollah and Jaish al-Mahdi.
This is a well-organized business for these individuals that carry out these attacks. Terrorism is a business, and they run it like a business.
They knew about what was going on for a decade. They absolutely, no question about it, knew that HSBC was washing money. They had every reason to understand it was for terrorism, and it was for drug cartels. Took no action whatsoever.
These banks are involved. Their accounts are connected, and they're using them to mask the transactions. The more complicated they can make the transactions, the more distance they can put between the bad guys and a seemingly legitimate purpose of these funds.
They pay $1.9 billion, which is a drop in the bucket compared to what they've made, and nobody goes to prison. These CEOs, these bankers that made this decision, they're safe at home. They know what they've done. It's resulted in the death of Americans, contractors and soldiers, not just hundreds, but thousands. And we look the other way because they don't look like criminals. The die is cast. The people that are responsible are on Wall Street.
And they don't look like criminals. It's almost a suspension of disbelief. Sometimes I'll have people call me and say, is this real? Do they really get away with this? Yeah, they do.